Your whole world kind of is flipped upside down. And so you wonder, what's next?
I was scared, I was confused, angry, anxious. It was a lonely time.
Here at MD Anderson, when you step through the doors, they make you feel like you are more than just a patient.
You feel you're coming to see an acquaintance, perhaps even a friend.
There was so much empathy, so much just care.
Every person from the janitor to the receptionist to the physicians to the technicians all really care about who they are personally.
They're not a patient, they're a person. I see them as part of my life, and how can I make their day better?
You're not alone. They're here to help guide you through the entire process.
The role of the patient advocate is to let them know that there's someone there. We're in your corner. We're going to help you out.
This is all about patient-centered care. It's nurses, it's nurse practitioners, pharmacists. Everything that we do is a partnership.
People feel supported in a multi-dimensional way. A person's environment, how stressed they are, what they're eating, physical activity, exercise, how it all relates to your care and your health.
We're looking at the needs of that whole person. We're looking at the needs of that person once they're done with their treatment here.
Because each patient's cancer and diagnosis is different, MD Anderson makes sure that the treatment plan follows that suit.
No two patients' cancer is the same. We're gonna look at a patient and say, why is this cancer here? How did it get here? What adaptations did it make to allow it to survive this long? And then we're gonna undo what it's done.
Once we know the problem in that particular patient, then you create a personalized, individualized, customized treatment for the genetic changes that have happened.
We have essentially entered into this era of precision medicine.
Finding a range of therapies that will work for certain classes of patients.
In terms of things like surgical techniques, radiation therapy techniques.
Approaches using advanced radiation technology like proton therapy.
But it's also analyzing the immune system and asking, can we reawaken the immune system so that it can attack the cancer?
The only way we're going to be able to eliminate cancer is to try new things, novel things. One of the strengths of MD Anderson is our clinical trials.
It's one of the few places where you have a really strong basic cancer research program paired with the strongest cancer clinical program. And the two talk to each other. We could take discoveries in the lab and bring them to patients all at the same institution. It's not 10 years, it's not 15 years. Sometimes it's 1 year, 2 years.
So MD Anderson is a global institution, both at its campus here and in terms of its reach.
Through mentorships and training the next generation of healers.
Having relationships with other institutions, informing the public.
There's been a huge effort focused around early detection and prevention.
It's important we connect and share advances.
To the underserved populations to make sure that everybody can have the same treatment.
I always felt comfortable that that was exactly where I was supposed to be.
You really need to make sure you have the right people there working with you through that journey. And I would say start right here.
Find your laugh. Laugh in the face of cancer. That's all you need to do.
These patients and their families, they're incredible in that they really are warriors. It only motivates me to continue on this war.
My father lost his life to this dreaded disease. I devoted my life at that point to ending those stories for other families.
It's amazing to look at, a newborn and think, at some point you're gonna live in a world with no cancer, where people aren't losing friends and relatives, and the world looks like a much brighter place.
And that is our mission.